Hi everybody, my name is Victoria Manella and I am a member of the ICMFEL International Christian Medical Fellowship, and today I'm here to bring to you our awareness topic of the month, which is ovarian cancer. So today you're going to hear things like the symptoms of ovarian cancer, the signs, the screening, the stages, the treatments, the prognosis, and etc. My colleagues will be bringing up all these topics today for you. So if you know somebody who's been diagnosed with ovarian cancer, or you have a family history of ovarian cancer, or you just heard about it and you want to know more about ovarian cancer, well then stay tuned to this video. So before I begin, what is an ovary? So the ovary are the female reproductive organs which store the eggs in your body. They also make hormones for the female body, and they also control your menstrual cycle and pregnancy. So when cancerous cells grow inside an ovary, and then over a period of time in different stages it becomes ovarian cancer. So unfortunately, ovarian cancer symptoms are not very specific, or they're not very alarming. Like they produce symptoms that are not very triggering to say, oh, this sounds like ovarian cancer. It could be bloating, abdominal pain, it could be a back pain, it could be irregular menses, things like that, but they're not always so specific. That's why it's not diagnosed early enough, or that's why it's not we don't really have the tools to diagnose it early on. There are some screening tests. Yeah, some doctors do the CA-125, some people do the transvaginal ultrasound, but these screening tools are not very specific, or they're very limited, for the diagnosis. So unfortunately, we still haven't found the accurate screening tools for it, but I know that there's some papers out there that are still trying to find which are the best screening tools for it. But before we can get into that, let's know a little bit about the risk factors. So what are the risk factors for ovarian cancer? Older age, inherited genes, family history, being overweight or obese, postmenopausal hormonal replacement therapy also does increase the risk, endometriosis, and also having your menses early or having your periods late. So how does that affect ovarian cancer? So having your periods early on, I mean the bleeding that a woman does go through every cycle, 28 days, and having your period like at a late age in life increases the time that a woman is exposed to ovulation, which increases the risk for ovarian cancer. So before I go into more details, please watch the video till the end, subscribe, comment, and see you till the end of the video. Bye.
Hi, Dr. Bala here, and we are excited to be back from ICMFEL. This month we'll be talking about ovarian cancer and breast cancer, but our awareness today is on ovarian cancer. I'm joining my colleagues here from ICMFEL. We'll be talking about the different aspects: introduction, epidemiology, the signs and symptoms, prevention, treatment, all of the different things about ovarian cancer. But I'm going to be giving just a very brief information about the epidemiology of ovarian cancer. So ovarian cancer, as the name is implied, of course, is cancer only found in women because women are the one who have the ovary, but it's actually one of the leading causes of death in women. In fact, according to the American Cancer Society estimate for 2023, it's estimated that 19,710 women will be newly diagnosed of ovarian cancer, and about 13,270 women will probably most likely die from ovarian cancer. So as I say, it's one of the leading cause of death, of cancer death in women. It is ranked the 5th in cancer death among women, the 5th cause of cancer death among women. So it's a serious issue, medical concern that need awareness. So we're joining the world. Last month, September was ovarian cancer month. This month is breast cancer month. So as we talk about breast cancer this month, we decided to also include ovarian cancer awareness, so just to give that information as well. And so the risk of a woman having ovarian cancer in her lifetime is 1 in 78, and the possibility or the risk of death is 1 in 108. Of course, it's found mainly in older women. About half of ovarian cancer patients women 63 years and above. Even though according to statistics and research published in other fights from published articles around the world, it has shown that there have been decline in the incident rate from 1990. There have been at least some level of decline in ovarian cancer. So from 1990 to 2010, there's been like 1 to 2% decline in the incident rate. From 2015 to 2019, there have been like up to 3% decline in the incident rate of ovarian cancer. So I think we can do better. We can even do more with creating awareness on the use of contraceptive and many other different things surrounding ovarian cancer. Women can get educated and we can be able to reduce the risk. Thank you.
Hello, my name is Dr. Annan of the International Christian Medical Fellowship, and we're creating awareness on ovarian cancer. Yes, ovarian cancer in the month of October. As my colleagues have already shared, I'll be talking about signs and symptoms. Ovarian cancer, like any other cancer, will present with no symptom at all. However, when you notice abdominal pain, persistent abdominal pain, bloating that persists for a long time, easy fatigability, unintentional weight loss, or pressure symptoms like urinating quickly or feeling satisfied after eating so quickly, it's time for you to visit your general practitioner or your specialist for further management. There is also an abbreviation, BEAT, for ovarian cancer, and B for bloating, that is persistent bloating. E for eating this difficulty, where you eat and you feel full so quickly. A for abdominal or pelvic pain, that is persistent. It doesn't go, it's persistent. And T for toilet changes or bowel movement, either you're having constipation or you're having diarrhea that persists for a long time. Not all shows that you have cancer. However, when you see these signs and symptoms, do not stay at home. Shalom.
Now we will discuss the different stages of ovarian cancer. Ovarian cancer, like many other cancers, have different stages, but it is very important to note that the earlier the diagnosis and treatment of it, the better the prognosis for the patient. Ovarian cancer has 4 different stages, and as the stages go on, the harder it is to treat and the lower and the worse the prognosis for the patient is. The first stage is where the cancer is only restricted to the ovaries. It could be one ovary or both ovaries, but it's only found in the ovaries. And at this stage, the best treatment plan is surgery. In some rare cases, however, some patients might require chemotherapy as well at this stage. The second stage is where the cancer has now grown outside of the ovaries and into the pelvic area. This may include the fallopian tubes or the uterus. And at this stage as well, the treatment plan would be surgery, but also chemotherapy would be highly recommended. The third stage is when the cancer has gone past the pelvic area into the abdominal cavity and lymph nodes as well. And at this stage as well, chemotherapy is recommended. Lastly, the fourth stage, the most deadly stage, is when the cancer has gone past all the first 3 stages and is now inside other organs such as the liver or the lungs. At this stage, it's very hard to treat as the cancer has grown into other areas of the body. And the best treatment option at this stage would be chemotherapy, and in some cases as well, surgery.
We have. And if you want to go for surgery, surgery can either be laparoscopic surgery. That means you are putting small holes on the abdomen of the patient, and then you use camera to be able to do the resection. Or it can be open surgery, where you're going to open the abdomen of the patient, have direct access to the cancer. Those are the 2 approaches that you can use for surgery. So we go now to stage 1 and 2, the early stage surgery. For the early stage surgery, the mainstay of treatment is surgery. What is the type of surgery that you're going to do? If you do open surgery, it means you're going to open the patient abdomen and you're going to get access to the tumor through the abdomen. You must remove the uterus of the patient, remove the ovaries of the patient, both ovaries. You have to remove the omentum. There is a structure overlying our intestine, like a blanket. We call it omentum. You have to remove them, and you have to feel and make sure there is no residual cancerous cells in the patient abdomen and pelvis. Then you remove all the lymph nodes. So it is an extensive surgery that you're going to be doing. And this surgery has to be done by people with huge knowledge on such procedure, because it's challenging, it's complex procedure. For this early stage patients, you do not need chemotherapy. However, some literature says that you can do adjuvant chemotherapy. That means after surgery, you can give the chemotherapy. But that is controversial. The advantage it has to the overall survival and disease-free stage of the patient is still controversial. But if in special patients, in patients that are high risk, high grade ovarian cancer, then there are benefits for adjuvant therapy. So after surgery in those patients, you can give adjuvant therapy. Otherwise, you don't need to give adjuvant therapy to patients with low grade stage 1, stage 2 ovarian cancer. That is surgery. For chemotherapy, we have, for advanced disease, that is stage 3 and stage 4 disease, you have to do what we call cytoreduction surgery. That is also the standard of treatment. The cytoreduction surgery is a type of surgery that you try to reduce the size of the tumor. We call it debulking surgery, because the tumor has spread beyond the local environment. It is huge, so you want to reduce the size of the surgery. It is the same thing as the first surgery we just described. You're going to remove the ovary, you're going to remove the uterus, you're going to remove the omentum. In the case you have to remove the peritoneum, there is a thin layer of tissue overlying between the abdominal wall and the intestine that we call the omentum. You have to remove those ones from there. You remove the lymph node. So again, and then after you have done that, then you give the patient chemotherapy. The first line treatment that be recommended is platinum-based chemotherapy. However, there are a lot of regimens that we cannot go through here, but you administer the chemotherapy, and that may improve the patient, overall survival or disease-free state, and may improve the quality of life of the patient. However, 80 to 85% of patients in advanced stage.
Hello there. So my name is Dr. Faustin, and I'm going to talk about the prognosis of ovarian cancer. We usually think about any type of cancer. We have to think about the stage first before we talk about prognosis. And then as usual, the separation of ovarian cancer is into 4. There is stage 1, stage 2, stage 3, and stage 4. And then depending on the stage where the person might be found, that could lead to a prognosis that could be very different. And also depending on what type of cancer, because as it was mentioned before, the ovarian cancer can be divided into a lot of types. There is the epithelial type of cancer, there is a stromal type of cancer, there is also a germ cell cancer. So it depends on what type of cancer the person has. But then, just to summarize everything and to say it in a brief way, stage 1, which is when the cancer is only limited within the ovaries, usually the survival rate within 5 years is around 85 to 90% according to some research. And then stage 2, that's when the patient actually have the cancer going around, like from the ovary to the lymph node that is around the ovary. And the survival rate go a little bit lower, around 70%, that the 5-year survival rate. And then on top of that, we have what we call stage 3, which is when the patient has the cancer cell spreading throughout the abdomen, and that actually will lead the patient to have a survival rate very low, around 30%, like 30 to 50%. That's the 5-year survival rate. And then the worst one, which is something that we call metastasis cancer, that's when it metastases not only in the abdominal area, but it also goes throughout the body, the brain, the lung, and the bone. So when you think about that, that's like an end stage kind of stuff, and most of the time the survival rate is within 15% for 5 years. So good thing is, the earlier there is a screening, the better we can catch it early, and the patient can be treated early. So that's pretty much what we have today. Thank you for tuning in, and may God bless you. Bye bye.